Well, Steve, the Multnomah County health officer says she expects cases will drop just as quickly as they spiked with the Omicron variant. But Dr. Jennifer Vines says that she does not believe we're at the peak in cases yet, and she anticipates that hospitalizations will follow. However, the county is still holding out hope for spring. Dr. Jennifer Vines says during this current wave, about 2/3 of cases in Multnomah County are breakthrough infections, and another 13% are in people with booster shots.
Our own internal disease trackers or epidemiologists are projecting that probably half of the Multnomah County population will be infected with Omicron between approximately mid-December and sometime in February.
The county health officer says forecasts project a peak in cases between this week and next.
There's a lot of speculation about whether we're at or near the peak in cases right now. We might be, but it's really hard to say. And we're frankly still quite concerned about hospitals. So remember that hospitalizations tend to lag infections by a few days.
Public Health Director Jessica Guernsey tells us masking will continue to play a key role, but she does not believe that closures or group size restrictions are effective at this point in the pandemic.
We're looking really carefully at how we adjust our response, given that we really don't want to flip-flop back and forth between guidance related to isolation and quarantine, masks, etc.
This comes as we learn more about a new subvariant, currently called BA2. We are hearing concerns of this new variant similar to the Omicron variant. How is your team tracking that, and do you have potential concerns watching that right now?
It's not something that we're actively tracking in this moment. Oregon Health Authority, along with OHSU, really look at the full picture of what are the variants that are circulating right now, as best we can tell. And as of last week, it was 95% Omicron.
Dr. Vines says she is optimistic about leaving the traditional respiratory season, potentially providing a reprieve during spring and summer. But experts say there is still the potential for another variant to throw the state off course.
They say no matter how many variants we have, what we need to do is stop the spread of the virus. If we do that, then we don't need to worry about any variants at all.
Variant after variant. We have been introduced to many new variants of COVID-19 ever since the pandemic started. And although Omicron is a lot more contagious, other ones are still around.
I think Delta still is around. I think a lot of what people are seeing, and that's actually kind of surprising, is it does seem that Omicron has kind of outcompeted Delta, but there do still seem to be some Delta cases around. Omicron seems to be just as bad as Delta. The big difference with Omicron is it seems to be able to infect people who've already been vaccinated and already been infected before.
Health officials explain why this new variant, BA2, is hard to detect.
It has more mutations on the S genes, so some of the PCR tests that are zooming on the S gene are not able to detect it as good as they were detecting Omicron.
And the big question,
nobody knows the answer to it, is are any of these variants going to be worse? Are they going to be getting over the immune defenses better? We really don't know.
And that's exactly what Oregon Health Authority and Clark County Health told me today. They both say they have too little information on BA2 to comment at this time. But no matter what this variant entails, as a virus spreads, more and more variants will develop.
And so what we need to do is to lower the amount of replication of the virus anywhere. And that means, get everybody vaccinated, not just in the US, but the whole world. And so if we can lower the amount of virus, fewer variants, fewer things to worry about.
I will be following up with our local health authorities as soon as more information becomes available regarding this new subvariant.
They canceled classes both yesterday and now today because of what the Alsea superintendent says, staffing shortages related to the spread of the Omicron variant. So that means this new mask ordinance is going to actually be debuting tomorrow. Now, giving you a little bit more background here, the Alsea School District, they're south of Corvallis, and on the 13th, the school board voted to pass this change in the mask resolution that would give that decision to students, parents, and staff. Now, the superintendent told us the move has the support of most parents and obviously the school board. He also called out state leadership in the process.
All these folks are real quick to sit on the sideline and judge, but they're not in the school every day. Yet all of them have said over and over again that classrooms are not a significant source of COVID spread, including Omicron.
Now, in order to stay in line with federal mandates, face masks are still required by all students and staff when riding the school bus. The district also outlining a zero-tolerance policy on mask shaming as they try to truly give the power back to parents, students, and staff and not deal with conflict in the classroom. Angelica.
Dan, I know this is kind of unfolding right now. So has the state caught wind of it? What's their response to this move by the district, if they have?
Now, we've reached out to the Oregon Health Authority and the Department of Education. At this point, we have not heard back. However, the superintendent did tell us last night that he heard from Director Colt Gill, who said that the district is currently in defiance of the state's order as it pertains to masking in the classroom. So we'll see what happens, especially once we hear back and what that could mean for the district.
Wait, in for Deb Knapp. Police say their staffing numbers simply don't allow them to do all they want to do. The union president says that needs to change.
Portland Police Association President Aaron Schmaltz says adding police officers will slow the surge in shootings in Portland. Right now, he says the fewer than 400 officers on patrol are mostly running from 911 call to 911 call.
We need to get back to a place where our police officers are able to be out of their cars, interacting with the community and building that trust, because people, if they don't think that when the police are there, the problem's going to be made better, they're going to look to other opportunities to make themselves safe.
Schmaltz says community policing will also restore trust in police within the community, especially among witnesses who may not want to share that info with officers. The union president says the police role should be part of the response along with the community.
A lot of this comes down to restoring a culture within our city, trust in the government, trust in police, trust in each other, and supporting our communities that are being really substantially harmed by the violence that's going on, because it is really impacting a small group within our city.
The community safety director and his staff are still deciding how to spend hundreds of thousands of dollars in grant money to community-based organizations addressing gun violence. A decision is expected in mid-February. Meanwhile, the police bureau is starting to tackle the mayor's goal of hiring 200 armed officers over the next 3 years.
Schmaltz tells me the fear in the community will die down if police are able to catch shooters and the DA's office prosecutes them. He says that will be easier if there are more officers to do the work.